Hi, David Liew here from Vienna, Eular 2024. Just finishing up what's been a busy but really interesting meeting. There's been lots of great stuff that's been discussed within rheumatoid arthritis. But I wanted to bring it back to something which I think is once again a daily practice. It's really about women who want to get pregnant, have rheumatoid arthritis, and want to know what to do. Because I think it's a time when you're trying to get pregnant and you're on medicines where there's all this talk about what the medicines might mean or what the medicines might do. It's already a time where there's a lot of anxiety, and then trying to get pregnant, trying to conceive adds that added level of pressure. So, what can we suggest for our patients with rheumatoid arthritis who are trying to get pregnant? And so, one key answer comes from Rotterdam, from the pre-CARA study. The pre-CARA study is a study which has looked at treat to target in women who are trying to get pregnant. And one thing that analysis that we saw at this meeting was actually the time to get pregnant, looking at how things were before the treat to target strategy and after the treat to target strategy. And I should say the treat to target strategy involved sulfasalazine, hydroxychloroquine, TNF inhibitor if required, low dose prednisolone if required, escalating up to bring the rheumatoid arthritis into remission. We saw that from comparing to before and after this was started, that there was a dramatic improvement in fertility in these women. So, roughly trying to gauge this from the Kaplan-Meier, after 1 year, we saw that about just over 50% of people previously were getting pregnant. It's quite a bit below the general population. And then we saw after, when it was treat to target, we saw it at 75%, which is pretty close to what the general population hitting. So I think the message is clear. If you've got rheumatoid arthritis, you want to get pregnant, disease control, disease control, disease control. With the right medicines, of course, but disease control. And that's something that tangible that we can give our patients, and something that always bears reminding. So I hope you've had a great Eular 2024, and plenty more still coming through on rheumnow.com. You know where to go.